Well, we are getting closer to the end, but we still have one session to go, and that is basically to see if we can come up with some distilled learnings, if you will, of the day. So to get to that objective, we've asked 3 of our Roundtable members throughout the course of the day to listen carefully and take notes on what they hear, observations that they find notable, and to give them lots of time, like 5 minutes, to let you know what their summary thoughts are. So to do so, we have invited Russell Pate, who's the Vice Chair of the Roundtable on Obesity Solutions, and a Professor of Exercise Science and Director of the Children's Physical Activity Research Group at the University of South Carolina. Marion Standish, Roundtable member, as well as Senior Advisor at the California Endowment. And Maha, Tahiri, a Roundtable member and Chief Health and Wellness Officer at General Mills, to provide comments. We'll start with Russ for 5 minutes, and then Marion, and then Maha.
Thanks. Thank you, Nico, and I'd like to begin by congratulating Nico and the organizing committee for putting together a tremendous day. It's a bit of a daunting task to try to process everything that we heard today, but I'll take a shot at a couple of comments that I hope will be coherent. First of all, we all process the information like we were exposed to today through our own personal prism, and that's true for me. So I've spent most of my career doing what I describe as applying public health research methods to the study of physical activity in children. And one thing I think I've become sensitized to in that process is, just how hard this is. This is difficult. And we work hard and we produce these tiny little effect sizes, and it's frustrating. And so I really resonated with something that Pamela Schwartz said this morning regarding dose and reach. And I just think those are, for those of us that care a lot about this issue, elements of the issue that I think we've really got to take a hold of. The thing I think about a lot is what will it take to just really change groups, in my case, of kids or people in communities, in institutions, enough to have an impact on a physiologic outcome like body composition and BMI. And that's not a minor undertaking. And even though I've worked in public health for a long time, I trained in exercise physiology. And so I do sometimes try to make myself think about not just groups of kids, but individual kids. How much of a change do we have to make in a kid's life in order to meaningfully influence that child's physical activity behavior, dietary behavior, and ultimately their body composition. And I'm not sure we absolutely know the answer to that, but I'm actually fairly optimistic. I think that if we can figure out a way to deliver our interventions with reach, meaning they really get to lots of kids in the target sample, I think that with fairly modest increases in activity and modifications in dietary behavior, if they play out sort of every day, so they really become part of the way kids live, I'm pretty optimistic we can make this happen. But the reach part of it is tough, and we're not all the way there with the dose part either. Second, I've spent a lot of time over the last 7 years working on the National Physical Activity Plan, which is a strategic plan for increasing physical activity in the U.S. population. And that plan, for those and others in the audience have worked on this as much as I have, the plan, if you're familiar with it, is organized around 8 societal sectors. So I've spent a lot of time in the last few years thinking about sectors. And I think there are 2 things I want to say. One is our emphasis today on intersectoral activity, in my mind at least, doesn't argue against continued efforts that may be intra-sectoral. I think much has been accomplished and can be accomplished in the future with strategies that will probably primarily operate within a particular sector. So I don't think we should just write that off. On the other hand, in my mind, what really does argue for expanded intersectoral approaches is the need to deliver that dose and reach. And I just think that experience, we've heard about it a lot today, argues that when we kind of triangulate on these behaviors and the ultimate outcome, our odds of reaching a lot of people and delivering a meaningful dose of the intervention is enhanced. So not to forget about intra-sectoral work, but I think inter-sectoral work is something I'm optimistic about being successful in the future. Third, I'm not going to name names, but I thought we heard today about some remarkable programs, and the point I want to make is we need models. We need good models, and we heard about a bunch of them today. And it's now up to us and others to disseminate those, because we need to make sure that people around the country that care about this know that there are successes out there, that you can do this stuff, and I don't think there's any better way to demonstrate it than to point out great programs like we've heard about today. And then, as David did, I want to finish by just going back to the four overarching considerations that Nico mentioned this morning. And I'm not going to say much of anything about the first three, health equity, leadership, and evaluation, other than to say that I thought the initiatives that we heard about today, I thought we're doing remarkably well in addressing those considerations. And I'm aware that this was not a random sample of initiatives that we heard about today, but they surely were doing awfully well in those areas. That leaves sustainability. And I guess I want to raise the same issue that I think Bill raised in an earlier question. And this is a good thing, but it seems to me that an awful lot of the initiatives that we've heard about today and have heard about elsewhere have been catalyzed by foundations and corporations. And heaven knows we've needed it. I mean, the obesity issue has come to the public awareness pretty much at the same time that we experienced the Great Recession, which put local, state, and federal governments in a position where there was no discretionary money. And so it's darn good that foundations and corporations have stepped up and enabled this work to go forward. But I think the jury's still out on sustainability and whether or not we can figure out a way to transition to an approach to generating the resources to sustain these efforts that will be there in the long run. Jeff Levy this morning pointed out that we have a national prevention strategy because there's a law that said we had to have it, and we have dietary guidelines and they're updated every 5 years because there's a law that says it's going to happen. And we have physical activity guidelines, and we don't yet have a law that says that's going to happen every 5 years, but I hope we're getting there. So, while we're, I think, going to continue to be dependent for a good long while on the tremendous support from the foundation and corporate communities, I think we do have to be working on government and finding ways to really institutionalize some of these efforts as we move forward. So, thank you.
Marion.
Great, and hopefully I can build on some of Bill's comments, and I also want to congratulate all those folks who were courageous enough to stand up here and be very candid about their experiences through the case studies. They're tremendously informative and very powerful. I can remember, and I think I've been in the world of obesity prevention long enough that I can remember when there were maybe one or two comprehensive community initiatives focusing on obesity in the whole country. And so I think I'll frame my comments with the question of, do we have a model? And is it a model that is sufficiently along to be replicated, and what are those elements of replication, and what have we learned, I think, from the discussion today that both maybe identify some gaps, but also suggests that we do have a model and that we should be moving forward to see that that model is built upon over and over again through a variety of funding mechanisms, which I'll also comment on. So I think the first comment on the model is, do we have a unifying narrative? And I think this is both a reflection on what I heard in the case studies and a critique, if you will. And the reflection is, I think we do have a unifying narrative around community transformation, the power of environmental change in influencing behavior and in improving lives. I don't think we have a tight narrative around either equity or obesity prevention or health. And I think David kind of was getting at this in his equity comment, because what are we after? What is our narrative saying about success? What does success look like? So I think we're not quite coherent, I would have to say, in a good way, a loving way, because I think we do want to do it all. But we also have to hold ourselves to account in terms of this idea of what are we expecting will change in our communities? What will be the transformative impact of our work? And I also think from a marketing perspective, and people talked about marketing, why does anyone want to join up with you if they're not entirely clear about, what success looks like and what are we after? Whether it's smoking cessation or civil rights. I mean, we really need to know what we're after if we're going to successfully scale up our model and really achieve the kind of change we want. And I think language matters, and I'm very interested in a further conversation about the use of words like obesity. In California, we've begun to actually use the word diabetes, because we think diabetes is something that people really do experience in a very powerful way. The inequities are dramatic, the harm is so significant, the crisis is overwhelming, and we think it's a great mobilizer in terms of the kind of policy and systems change that we're after. But I think it really begs the question about our narrative and what we're about and how we intend to get there. And a comment that I think Jeff made, and we'll both quote Jeff, he was very good earlier, was the notion that we're both flexible and intentional. So the idea is that we have a lot of intentional outcomes, and I think this is important in the narrative, but the way we get there is very flexible. We really know that there are many ways in different communities to achieve the outcomes that we're after. Because after all, and this is, so narrative is my first point, measurement is my second point, and I think in our model, we've really clearly shown, and everyone spoke to, the level of measurement and the level of sophistication that we're getting to in understanding how to measure the outcomes. And I think Kaiser Permanente has really contributed a lot to the field in terms of whether we call it dose or strength or whatever we call it, we need to know what is working. And the concentration of interventions may be what we need to see in order to see an obesity outcome or a community transformation outcome or a diabetes outcome, but we really need to understand it. And I think, to scale up, we have to be able to measure what the cost savings will be. And this kind of feeds into another point I want to make around core partners, which are also part of a model, that you have core partners that you're working with. And I think there was a question at the very end here about the Affordable Care Act and the healthcare system, and I think it's noticeably absent. And that's where all the money is. So I think if we're looking for a return on investment, it's clearly going to be primarily to the healthcare system. That's where the return is going to be. And where does that return go once we identify it? Well, it ought to go back into all these programs that we think are so effective. And I don't think we've yet crossed that Rubicon in terms of really understanding how to measure that. Not only the return on investment in terms of healthcare, but a social return on investment in terms of these larger community transformation efforts. And we need to measure that again and again as we solidify, or at least refine, not solidify, but refine our model. So the healthcare system has to be added, I think, at this point with the Affordable Care Act, with the new incentives that they will be living with as part of our model and part of our collaboration. And I miss them in the discussion. I know they're there in some places. Nemours is there. HealthPartners are there, but I felt like we needed to pull them out a little bit more. And the food system, I was really glad Cook County talked about the food system in its entirety, you know, but we never really talked about agriculture. And after all, on the food side, we are talking about food, and yet we're missing a big piece of the food system. And I think they need to be become a different kind of partner in our work. And lastly, and probably the most important part of our model, is community infrastructure. And I mean that to say that we cannot succeed in this work without the community capacity to implement, hold institutional players accountable for doing better, for a policy and systems change that may be passed by a state or local legislature but not effectively implemented. We need the community to be, yes, everyone said resident engagement, yes, 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 but the kind of accountability requires capacity in the community to understand the data, to be able to do the advocacy, to be able to be policy leaders, policy makers at that level. Because without that, we're going to have great policies and they're not going to matter. So I think, you know, these are the elements for me of a model. I think we're really far along. And I think we have a model that we should begin to spread systematically so that we get the kind of scale and impact that we're after and can really begin to generate funds and revenue from public and private sources to support this work for the long run. So that's kind of what I heard.
Thank you. Maha?
Okay. So I have been in conferences on obesity for the last 15 years, so I'm sure many of you have been. And it's usually very depressing. And I must say that I'm very happy that this day was not depressing. I have two O's for this day: openness and optimism. I think we have been very diligent in being focused on the solution, not on the problem, and not on finger pointing. So I'm very glad that we have stepped to that level, and I wanted to share just with you some of the thoughts that either energized me or resonate with me during the day. So I think when Wilfried mentioned that health equity is a just and fair inclusion, I thought, what an incredible goal that we all could share. And in the industry, we talk about, at least in General Mills, we talk about consumer first. I think in our case, we could all align around health equity first in mind in everything we design. And I'm pretty ready to bet that we would all agree with that. Deborah said also, talked about the 3 T's, and I love that, the terminology and the alphabet soup. And so there are a few ingredients that came to mind: the secret sauce, the alphabet soup, that will stay in my mind. Deborah talked about time, and the way she talks about time, it takes time to get to see the world with the perspective of somebody else. That's openness. And when we get there, and when we get to that level of openness, I think we are ready to collaborate and really share together. From Pamela, I really like the two-pronged approach of both looking at population health and intermediate outcomes, Because if you only wait to see population health, that will take a long time. And I like the approach because it will help us really to learn as we progress in finding the solutions. But then we have fantastic lunch. And we started the afternoon by a formidable call to action by the Surgeon General, and really he shared that optimism for health and for putting health not ever as a secondary priority, but a first priority. So that energized me too. I think it was Sue who talked about the fit well building that I loved. I spent many years in Africa and many years in Europe, two continents that really have environments where people walk, where people move a lot. So I resonated a lot with that. I was sitting yesterday, and I had to do that in a flight from Minneapolis, where I agree, Bill, there are a lot of nice people in Minneapolis. So I was sitting next to a lady, she was 82, and she was really in formidable health, and she started talking about smoking and the evolving, and then she said, like, sitting should be the smoking of the old days. And I thought she was so right. Yeah, sitting is our issue. So anyway, we couldn't, it was too dangerous to like not sit in the plane, but whenever we can, I think we should. And then the afternoon with the case studies were really the culmination point of everything that was said and behaviors that were referred to during the morning. I really thought that whether it's the Nemours, the Cook County Place Matters, the Up for Health or the Power Up, the dedication, the passion, the belief that you have in your programs is incredible. Bonnie, thank you, because you really bring it to life for many of us. And for me, it was really inspiring to hear all the examples. They have commonalities. Strong local programs that ensure that we have impact, but some of them also are looking into scale, which requires flexibility. And I'm going to refer to Nemours because General Mills Foundation has a partnership with Nemours. You guys have been very flexible, and we kept on challenging them and coming up with, we want scale and we want impact and we want to be able to measure, and really, the teams have been very, very creative and flexible in finding the solution in the partnership. I thought that the 4 initiatives had deep knowledge and expertise of their audience, their stakeholders, their ground with strong relationships. And again, I couldn't stop without saying the word dedication, passion, and pride that is really well deserved for what you have done in your communities. So thank you for these testimonies, and I come back to my openness and optimism that will, I'm hoping, bring the solution that we all aspire to.
Thank you very much. Wow, that was very succinct and to the point. Very well done. In closing, though, I would like to thank very much our participants of today, everybody coming in from all over the country to be with us today, as well as those on the webcast who've been listening in all day long. That's quite a feat in and of itself. Then there is the planning committee to thank and the IOM staff. So please join me in a round of applause for everyone. I should mention that the presentations and the discussion of this workshop will be posted on the website. It's www.iom.eu/cross-sector. And a brief summary of the workshop will be published as well in a couple of weeks. And then a full written summary of presentations and discussion by early next year. And finally, the speakers and the roundtable members are welcome to join a reception in the members' room after the adjournment. So this morning, when I introduced the workshop, I actually referenced a quote from John Gardner, is "He who would effect social change cannot be of short wind." I think that today we certainly haven't been short-winded. There's been a lot said, but of course today it's not just about today, and now really the work has to begin. So I would actually like to end with a quote from my grandmother, who always used to tell me, you know, Nico, all the work is done except for doing it. So with that in mind, you think you've got a lot accomplished, but there's a long way to go, long way to go. I certainly hope that you've enjoyed the day as much as I have. And so with that said, thank you very much for participating in our workshop today. And with that, the workshop is adjourned. Thank you.